You're watching CTOM TV. Knowledge is power.
So I'm just going to talk briefly about what the standard therapy is. And so obviously the standard therapy refers to surgery. And so surgery is very important in this disease.
Yes, you were saying that was the number one thing when you were talking
Yeah.
about life expectancy. How much of the tumor are you able to remove?
Exactly. And we'll get into that.
Okay.
So the standard treatment is what we call craniotomy and Stupp protocol, also known as TMZ. And that's a drug called temozolomide. It's an alkylating agent and radiation. So you do both of these. TMZ is fairly easy to tolerate. It's a soft chemo. It's basically a derivative of mustard gas. And so when they came out with the Stupp protocol, it really changed life for people with GBMs. So before that, survival was less than a year. And very, very few patients lived 2 years. With this TMZ, with temozolomide plus radiation, the average survival is 15 to 16 months. So 50% of the patients with this treatment live 15 to 16 months. And the 2-year survival rate is about 20%. 27%. So, even with TMZ, it's a big jump. For some people, it's going to make a huge difference. For other people, it's not going to work so well, as you know. So if you're class 1, class 3 under the classification designations that we discussed earlier, if you're class 3 and you have MGMT methylation, you're over 50 but high CMET, then just because you have this prognostic feature of MGMT methylation does not mean you're going to respond well. You have to look at, and I think that really outlines the importance of looking at desensitizing mutations. So in other words, people are going to say, the doctors are going to say, hey, you're going to be great. You've got a great survival chance. You've got a methylated MGMT. But that's only true if you also have low CMET expression.
Right.
So you've got to look at everything. You can't just go with the basics.
Yeah.
So another drug that's used quite commonly in brain tumors is called Avastin. This is an inhibitor of angiogenesis. It's a VEGF inhibitor. The important thing with Avastin is it tends to prevent brain bleeding because it inhibits angiogenesis. And as you know, angiogenesis is leaky blood vessels. So a lot of doctors will use Avastin just to prevent brain bleeding and so on in the patients. But what we do know is that in some patients, Avastin can be very beneficial, and in some patients it can't. It won't do anything. So the good thing about Avastin is what we do know now, and relatively new data shows that it's the amount of neutrophils that you have when you start your Avastin that really determines whether Avastin is going to be beneficial for you in a brain tumor.
And remind us, what's a neutrophil?
It's a type of immune cell.
Okay.
So if you have a high neutrophil count, I believe it's 6,000 millimeters squared. 6,000 mm by the power of 3.
Okay.
If you have something, it's basically high neutrophils. So if you have high neutrophils at the time of taking Avastin, you're going to have a much better response to this drug than you will.
Than those who have a lower amount of neutrophils.
Exactly.
Okay, and how do I test for those?
It's just a standard blood test that's normally done.
Okay.
Now, the problem is this is relatively new information. Your doctor's probably not going to know that. So this is something you need to take on yourself. Look at your neutrophil and use that as a guideline as to whether to take this drug or not.
That's for Avastin specifically?
Yeah, exactly.
Okay. Which helps to slow... Does it stop angiogenesis? Or that's what it... Okay. Yeah. Right. And it will work better for you if you have a high neutrophil count.
Exactly.
Okay.
So now we're going to talk about the ketone favorites. We're just going to talk about a few of them because we don't have much time
No,
and
we don't.
there's a lot to cover.
Okay.
Thank you for watching Ketone TV. Subscribe below and stay informed.